The voluntary registration report in Primary Sense was made available in September of 2023. The report is designed to highlight patients at risk and likely to meet criteria for registration for MyMedicare. Please always check if patients are already registered for MyMedicare at another practice. To open the report in Primary Sense, simply click on the Primary Sense desktop application and click on Reports. This screen will then appear, which shows all the Primary Sense reports. From this screen, simply double-click on Voluntary Patient Registration, which will then open in your default browser. What you're seeing now is a Voluntary Patient Registration report in Primary Sense. If you select these 4 tiles up the top, you can see which patients are included in this report, what data is in this report, how to use the report, and what are the ACG complexity levels. If we scroll down, we can now see patients that are likely to meet criteria for voluntary patient registration at your practice. If we start from left to right down here, firstly, you see Remove. If this option is clicked, the patient will no longer appear in this report for the next 12 months. Next, you have the patient name, the patient phone number, when the patient last visited the practice. Existing appointment will display the next booked appointment for the patient's usual GP at the practice, the age of the patient, Aboriginal or Torres Strait Islander status of the patient, the complexity score of the patient, and this is calculated by the ACG Johns Hopkins tool. To understand more about the tool, simply scroll up and click what are the ACG complexity levels. Next, we have visit count. This is the count of visits to the practice in the last 2 years by the patient. Next, we have risk reason. So risk reason will display one or more reasons the patient is determined to be at risk and likely to meet criteria for voluntary patient registration at your practice. Here are the examples why the patient may be likely to meet criteria at your practice. Hospital risk. So that means that the patient is at risk of hospitalization of 80% or more in the next 12 months. And that is calculated once again by the ACG Johns Hopkins tool. To understand more about this tool, simply click up here. What are the ACG complexity levels? Next, we have frailty of the patient, and that is coded by either the GP in the clinical software or by the ACG Johns Hopkins tool. Next, we have polypharmacy, so more than 10 medications prescribed in the past 18 months for the patient. Next, we have EDs, so 2 or more discharge summaries in the past year. And finally, we have complexity. So that means the patient has an ACG Johns Hopkins band risk of 4 or 5. Once again, to learn more about these bands, scroll up, click what are the ACG complexity levels, and you can see what level 5 and level 4 are. Once again, in this risk reason, more reasons can appear. In my example here, the 2 dummy patients are only appearing due to polypharmacy. Next, we have fragmented care. That will display 1 or more reasons the patient is determined to have fragmented care. Hospital reasons are not seen, so they haven't been to the practice in the past 6 months, or they have been to the practice and seen 3 or more GPs in the last 6 months. So what you can see here in this example is this bottom dummy patient, Samantha Davies. has not been seen, which means they have not been in the practice in the last 6 months. Next, we have the count of active medications for the patient. Frailty, once again, coded by the GP or calculated by ACG. And here we can see if the patient is eligible for a health assessment. And that is checking if one has been billed in the past year. If the health assessment has been billed in the past year, the patient would not be eligible, and here you would see a no. Throughout any primary sense report, you can filter on how the patients do appear. If you wish to sort, for instance, age by youngest to oldest, simply click on age once, youngest to oldest currently, or again, from oldest to youngest. If you wish to sort by GP name, you can click on GP name and it will sort alphabetical order for you. As with any primary sense report, you can export these to Excel, to CSV, and also export to CSV SMS. If this option here is selected, you can then directly upload the CSV to your practice software and SMS patients. If you have any questions on this report or primary sense, please contact your local primary health network.